March of 2020, the World Health Organization designated the COVID-19 outbreak as a global pandemic. The respiratory virus originated in the city of Wuhan, China, and quickly spread to all major metropolitan areas in the matter of a few months. The consequences of the outbreak are still in full swing at the time of this recording, including travel restrictions, lockdowns, and economic fallout across the world, although the degree to which the pandemic has been successfully contained varies widely across countries and cultures. Some countries have demonstrated effective leadership and national participation in preventative measures, while others have fallen behind and now face tremendous population loss and economic collapse in comparison. The factors that contribute to these variations in the effectiveness of response strategies are wide-ranging and will undoubtedly be examined for years to come. Throughout this presentation, I'll be examining one of the most important factors regarding pandemic response, that being individualism versus collectivism in the cultures impacted most by COVID-19. Before I get into it, let's define what these two types of cultures are. Individualism versus collectivism is one of the four cultural dimensions as defined by the Dutch social psychologist Gerard Hofstede. A culture's position on this continuum is determined by the degree to which cultures encourage people to look out for either themselves and their immediate family or members of their culture as a whole. Specifically, members of individualist cultures tend to put themselves and their family above all others and prioritize self-sufficiency, privacy, and freedom of expression. Wealth is highly correlated with individualism, both on a personal and national level. Examples of individualist cultures are primarily modern and Western cultures such as Canada, the United States, Germany, the United Kingdom, and South Africa. Members of collectivist cultures, on the other hand, tend to value conformity above all else. Individuals tend to focus less on personal needs and more on the needs of the society. There is an emphasis on in-groups versus out-groups, and opinions are generally decided by loyalty to one's in-group or culture as opposed to beliefs of individuals. Examples of collectivist cultures include Japan, China, Argentina, Korea, and Venezuela. Most small societies, such as tribes, tend to be collectivist. The majority of countries have responded to the COVID-19 pandemic using stringent preventative measures including social distancing, mask mandates, and partial or total lockdowns. International travel restrictions have been put in place in almost all countries in an attempt to prevent an influx of cases. The Oxford COVID-19 Government Response Tracker demonstrates several interesting trends in preventative measures taken by countries around the world. Densely populated countries, such as the United Kingdom and China, have had the most stringent measures since the beginning of the pandemic. Of course, densely populated areas have also suffered the most in regard to COVID-19 cases and deaths. However, there is a stark difference between individualist and collectivist cultures in terms of these rates. Notably, the difference does not exist in severity of preventative measures, implying that collectivist cultures have enforced these measures more effectively. To illustrate this, let's compare 3 individualist countries to 3 collectivist countries as defined by the Individualism Index. These are the statistics for Japan, South Korea, and Portugal, which each have a score under 50 on the Individualism Index and are therefore considered collectivist. While population densities range between these countries, stringency of pandemic measures as of April 1, 2020 was consistent between South Korea and Portugal, though it was much lower in Japan. This is an interesting statistic because cumulative cases for all 3 of these countries was under 1 million as of March 1, 2021, though Japan had the lowest number with less than 500,000 cases reported. When compared to the same statistics for 3 highly individualist countries, it's clear that there is a demonstrable difference between the 2 types of society. Germany, Italy, and the United Kingdom all had relatively similar population densities to the collectivist cultures I listed earlier, and the stringency of their measures was generally higher, again based on April 1, 2021. The cumulative cases, however, was above 2 million for all 3 countries as of March 1, 2021, and even surpassed 4 million in the United Kingdom. Granted, a comparison of 6 countries doesn't do justice to the complexities associated with pandemic response. Luckily, studies have already emerged comparing these two types of society in terms of their success with pandemic management. A study by Huan and others, published in November 2020, examined differences between regions of China considered either collectivist or individualist. By examining social media trends during the beginning of the pandemic and then scoring them based on fear, collectivism, and preventative intention, they found that fear and collectivism interact and influence preventative intention of the individual. Collectivism was consistently found to increase preventative intention. Other studies have also been published recently that examine this phenomenon on a larger scale. A study published by the National Bureau of Economic Research in September 2020 compared a total frontier experience value, a measure correlated with high individualism, between United States counties in the context of preventative compliance. They found that counties with higher TFE scores, and therefore higher individualism, were associated with a lower rate of mask use, social distancing, and trust in science than counties with a lower individualism score. Similar findings were published by Bien and others in August 2020, noting that higher individualism correlated with lower rates of social distancing and economic redistribution via donation websites such as GoFundMe.com. Collectivism was also demonstrated to positively correlate with preventative effort on an individual level by a study published by the British Psychological Society. They examined conspiracy theories, feelings of powerlessness, and preventative measures such as social distancing in individual societies. As expected, individualism proved to be a strong predictor of preventative effort, as well as belief in conspiracies and feelings of powerlessness in the face of crisis. This data forms a compelling case for a point that you probably knew before viewing this presentation. Societies that encourage helping and relying on each other typically fare better in times of crisis. Individualist societies may have advantages in terms of innovation and economic advancement, but individuals generally fare far worse when faced with issues that can only be solved with the cooperation of an entire society. If there's one thing that the COVID-19 pandemic has demonstrated when it comes to differences between cultures, it's that those that build themselves on selfishness and division are vastly unprepared when it comes to times of crisis. Though the effectiveness of pandemic responses is largely dependent on government action and the economic feasibility of staying at home, ultimately our success in dealing with any crisis will be determined by the degree to which we are willing to work together. Given the data presented here, I can only hope that we'll be better prepared the next time our individualist culture is tested so rigorously.